Hi and welcome to Askimo TV. We're talking today to Dr. Joseph Aquilina. Dr. Aquilina is a UK consultant, gynecologist and obstetrician. Hi Dr. Aquilina, how are you?
I'm fine. Good morning. How are you?
Very well, thank you. Today we're going to be having a discussion about menstrual disorders, what they are, some of their signs and symptoms. Let's begin with, what is a menstrual disorder?
A menstrual disorder is a problem with menstruation. And generally, when we say a problem with menstruation, it's normally heavy periods or irregular periods, although it can include issues like premenstrual syndrome, which can be included in that. You can also refer to the problem as being infrequent periods or periods with big gaps in between. So it's an all-encompassing sort of term to include all problems associated with menstruation.
What are just a few of some of the various types of menstrual disorders that a woman may suffer from, and perhaps just give us a symptom of one of those?
The most common menstrual disorder that women would suffer from would be heavy periods, where the menstrual flow would be considered excessive by the woman, which can result in obviously problems in terms of social activities or work. Another common one would be irregular. Sorry,
carry on.
And another menstrual problem would be irregular periods, where the periods where they do not come at a regular interval, and that in itself can constitute an inconvenience in that it may catch women unawares, and obviously can be very unsettling.
What are the main concerns or risks for women suffering with menstrual disorders?
Well, there can be health issues in women who have heavy periods, in that they can, when this happens over a long period of time, can result in anemia. Anemia, when the blood, hemoglobin is low, can result in symptoms of tiredness, lethargy, shortness of breath, when it is really severe. We mentioned previously as well the social connotations of, or social effects of having such a problem.
How common are menstrual disorders, and who is at risk for getting a menstrual disorder?
Menstrual disorders probably affect about 1 in 4 women, generally across the board, and they tend to be commoner at either end of reproductive life, especially so teenagers, who just started their periods, and women towards the latter end of their reproductive years, closer to the menopause. You will find that these two groups of women are the most likely to have problems with menstruation.
What causes the menstrual disorders, and why?
Okay. The most common cause of menstrual problems in the teenagers and the women in the end of the reproductive years tends to be hormonal irregularities, which in themselves would tend to resolve after 2 to 3 months. In terms of the percentages, towards the women, towards the end of their reproductive life, meaning the early 40s, there's an increasing likelihood that there will be some what I call structural lesion associated with with the uterus. So as a ballpark figure, I would say that women who present with heavy bleeding over the age of 40, approximately 25 to 30% will have an underlying anatomical problem, mainly fibroids or endometrial polyps or endometriosis as the principal causes.
How are menstrual disorders diagnosed and treated?
Menstrual disorders are diagnosed generally when you go to the doctor. They take a good history, they assess the severity of any anemia, if there's heavy periods, and then generally, it depends where you are, you'll be referred to initially for an ultrasound scan of the pelvis to look at the anatomy of the reproductive tract. This would be combined with a blood test to check the level of hemoglobin in the blood and possibly the level of iron if the issue is heavy periods. It would also entail a smear test in the first instance if the smear hadn't been done in the previous 3 years, depending on which country the person is residing in. But generally, I would say minimum smear once every 3 years will be considered as appropriate. Again, one of the other conditions which might present as heavy periods would be underactive thyroid, for example. So, an underactive thyroid, would present with not just symptoms of tiredness, but also cold intolerance, possibly voice changes. And it might be appropriate that you would need checking the thyroid function, but not as a routine. What we found was that a few years ago we used to check thyroid function for all women presenting with heavy periods, but what we found was that it doesn't pick up too many women with underactive thyroid. But if there are other symptoms, then it would be advisable to check thyroid function.
Just a final question. What is the prognosis for women suffering from menstrual disorders?
Okay. The prognosis will very much depend on what the underlying cause is. As we said, if it's menstrual, if it's a hormonal imbalance, then that tends to resolve on its own within 3 to 4 months. And some generally does not require any treatment, although sometimes a short course of hormones might be appropriate if the irregularity or the heaviness is causing inconvenience. If there is an underlying problem detected, like an endometrial polyp or like an endometrial fibroid or condition called adenomyosis, which we can discuss later, then generally it would be surgery. The type of surgery and the extent of surgery will very much be dependent on the type of lesion that is picked up. But I'm not sure whether we need to go through it now with each specific example, or you want me to go through each specific example?
You can give us an example, yes.
Okay, for example, fibroids. Fibroids are what we call benign tumors of the womb, and generally, if a woman is suffering from heavy periods as a result of fibroids, there are essentially 2 options. One of them is to remove the fibroids themselves and preserve the uterus, or if a woman has completed their family and do not want to preserve the uterus, they can have a hysterectomy. So I would say generally these days, most women tend to want to preserve their womb, and so we're doing a lot more removal of fibroids and preservation of the uterus as opposed to removal of the uterus on its own.
Thank you, Dr. Aquilina. Thank you so much for talking to us today.
Thank you very much for your time.